Good morning, everyone. We are all aware that the World Immunization Week is celebrated annually and is starting from today. And from today, that is 24th April to 30th April. And the goal for this year is that immunization is humanly possible for all. What does this mean? This basically means that we should increase the usage of vaccines and we should promote vaccine usage for decreasing the infectious disease in all age groups. And now we have to understand that vaccination is generally safe, but there are certain conditions where we have to exert certain caution before giving vaccination. What are these conditions? These are certain autoimmune conditions. And before going on to conditions, I would like to tell you, or we'll first discuss what are the type of vaccines we use. These are two kinds. One is live vaccine and another is inactivated vaccine. Live vaccine basically means that it is attenuated vaccine. It is an attenuated particle of the virus or bacteria that produces a strong immune response which mimics almost a natural infection, which basically means it has the capability of triggering the autoimmune flare also. Whereas the killed vaccine basically means the stimulus or the virus or bacteria that is introduced is actually killed or it is inactivated. So the immune response it produces is slightly less than the live one, but it does not have the capability of producing the disease. So let us first understand. Once we have understood this, then we'll apply it to the conditions. Now let's come to one by one the conditions, the autoimmune conditions like multiple sclerosis. It is a chronic disabling condition which affects the nervous system, especially the CNS or the spinal cord or even the optic nerves. Now, in this condition, since it is autoimmune, it is always preferable that we use inactivated or killed vaccines because live vaccine can actually produce a trigger or can cause autoimmune flare. Similarly, in other autoimmune conditions very commonly seen like rheumatoid arthritis or SLE, we commonly call it as lupus. In rheumatoid arthritis, it depends upon patient is getting what kind of treatment. Suppose the patient is on steroids, usually they are on biologicals or immunosuppressives, then obviously the same rule applies, which means we will be using inactivated vaccines safely and live vaccines we will be avoiding. Now same way in lupus, the treatment is mainly steroids, high dose of steroids. So these patients get immunosuppressed and we don't want them to have the disease again or have the autoimmune flare. So definitely once again, always we have to remember that generally inactivated vaccines are safe, whereas live vaccines are contraindicated or we should not give. Now what are the examples of these live vaccines? Usually MMR or even oral polio vaccines or varicella vaccines. Inactivated are lots. So we have to remember that all the conditions wherever the patient is immunosuppressed or even in these autoimmune conditions, we should always remember to give the inactivated vaccine and avoid the live vaccine. Another important condition, Guillain-Barré syndrome, in which the peripheral nerves are affected, which causes muscle paralysis. There has been seen in certain studies an association between flu vaccine and Guillain-Barré. So always be cautious in giving flu vaccine to patients who have had this history of GBS. Generally, in these patients, all other inactivated vaccines are safe and live vaccines anyways should be avoided. So I hope this information helps all. Thank you so much.